Rewarding careers, experiences of a lifetime. Explore travel PT at aureusmedical.com. AUREUSmedical.com.
NPTE StudyCast.
Welcome to NPTE StudyCast. I'm your host, Jimmy McKay. Back to the show, still focusing on the knee area, is Matt Tuttle from the Denver Nuggets. Matt, welcome back.
Thanks, Jimmy. Appreciate it. Knock out another knee topic here today.
And what are we looking at in the knee area?
I think after talking ACL, I think it'd be good to kind of talk meniscus, one of those other structures that can be involved with those injuries.
Yeah, meniscus tear. All right, so describe that pathology briefly for us. What needs to be in our head as we're attacking a potential meniscus question on the NPTE?
So it's remembering that the meniscus is the fibrocartilage component in the knee that rests on the tibia. There's two of them, a medial and a lateral meniscus. And that these injuries can be degenerative in nature. They can also be from an acute injury. So considering both of those when looking into these is important. And these tears can range in severity and symptom pattern as well. So, some degenerative tears may be small in nature. They may be very large. How these patients present and their functional capabilities can change and range greatly.
Anatomy.
Let's look at what's involved in a meniscus tear. What are the things that come to mind in terms of anatomy when you have a potential injury like this?
I think considering both the medial and lateral meniscus, and then what other structures kind of directly relate to those. So especially when you're palpating or trying to palpate this region, where these individuals are having pain would be also considering like MCL, LCL, the hamstring insertions on the posterior aspect. So making sure that you're not just looking medial lateral meniscus, but what else around that region may be involved.
Special tests.
Talking about considering other structures, how do you start to rule in or prove in or disprove it? What special tests do you start with?
Yeah, this is a loaded question. I think it speaks to how broad these injuries can be in nature and in mechanism. So I think some of it is gauging your patient's irritability. So what are they going to be able to tolerate? But really the best special tests out there would be looking at Thessaly's, McMurray, or like an Apley compression to try and determine from a special test nature if the meniscus is involved. But then a lot of the more common ways to look at this would be palpation and their symptom pattern. So they have any joint line tenderness that may indicate a meniscus tear? Are they having any buckling, clicking, locking, give way episodes that can all be related to a meniscal injury as well?
Imaging, what's the go-to imaging suggestion for someone with a potential meniscus tear?
Any injuries around the knee, right, your go-to is always to try and obtain an MRI if you deem it necessary. Also being cognizant, because there are so many degenerative tears out there, that there are times that we don't necessarily want to push these individuals for immediate imaging.
Differential diagnosis.
A lot of things to consider around the knee area. What's some differential diagnosis that would come to mind when a potential meniscus injury is in front of you?
This one is a long list, but in the acute injuries, and if we try and separate it again into an acute and degenerative, would be, is there an ACL, MCL, LCL, PCL? Is there another ligament injury going on in there? Do we maybe have a hamstring injury if we're having posterior joint pain? And then on the more kind of chronic degenerative injuries would be thinking about like a degenerative joint disease, patellofem pain. Is there a chondral defect? The concept around, maybe a discoid meniscus. There's a lot there when you're considering a degenerative meniscus injury.
Treatment examples.
So once you've ruled in and you know what you're working with, and you're working with someone with a meniscus tear, treatment examples, where does your head go in terms of what does this person need to rehab properly?
I think it's easiest to separate these. I think in an acute meniscus injury, early on, although it's not the most popular opinion, right, is to just get these individuals comfortable. So it's the gentle range of motion, ice, trying to limit some of the inflammatory process and restoring kind of basic functional capabilities. If you're not able to do that, is there a surgical intervention may be appropriate, whether that's a meniscectomy or a meniscus repair. And then if you have individuals that have some functional capability already and are maybe going the non-surgical route, would be progressive strength training, activity modification, maybe some low-grade joint mobilizations if deemed appropriate, and then a progressive return to functional activity.
Here's your example question.
All right, so everybody's favorite section of the show. Want to see how it might appear, an example question. What do you got for us today, Matt?
Yeah, I would say that If you have a patient that presents to the clinic reporting that they felt a pop in their knee when playing soccer, the patient states that they are concerned they have a meniscus tear, which of the following is the most appropriate special test? A pivot shift, B, a prone dial, C, Lockman, or D, Thessaly.
All right, so we've got pivot shift, prone dial, Lockman, and Thessaly. Right answer. What do you got for him, Matt?
Thessaly would definitely be the right answer. All those other tests are involved with structures around the knee, but Thessaly is the most appropriate for testing the meniscus.
And I do like how you inserted the pop in the knee, because a lot of times when you hear a pop in a question, you automatically assume that it's ACL, I think, comes up a lot, or a lot of students start to assume that way. So I like how you threw that, but you made them pay attention to, hey, you saw a pop, but they were asking about a meniscus tear. And so the NPTE isn't there to confuse you, but it is there to test you. So don't just read the word pop and automatically go for a test that will assess the ACL. All right, that's taking a look at meniscus tears here on NPTE StudyCast. We will have an infographic available for you. Take a look in the show notes of this episode to download that for free. Download free study guides now at aureusmedical.com/NPTE StudyCast. aureusmedical.com/NPTE StudyCast. Rewarding careers, experiences of a lifetime. Explore travel PT at aureusmedical.com.
NPTE StudyCast. Brewed by the PT Pintcast.